Well, hello. I'm here with Dr. Max Irsik, and he is a doctor of veterinary medicine, and he's also the University of Florida Extesnion Veterinarian. And we're here at the Northwest Florida Beef Conference and Trade Show here in Marianna, Florida, in 2011. And Dr. Irsik, you're talking to the group today about antibiotics, drug use in cattle. What are some of the things that a producer needs to know and think about before they decide on what kind of drugs are using drugs in their cattle?
Okay. Well, that's a really big topic, and we'll try and see if we can't distill this down to just a few thoughts in general. Number one, they need to understand what the appropriate use of an antibiotic is. They need to understand that they need to use those drugs the way those drugs are labeled or prescribed. And when I talk about label, I'm talking about, say, over-the-counter drugs like LA200. If the label says, you can use this to treat pneumonia, and you give it at 1 ml per 25 pounds of body weight, and you give it sub-Q, then that's how they're to use that antibiotic. They have to follow the withdrawal times. And then when they start moving over to the script area, where they're getting script drugs, which are prescribed by their veterinarian, they need to follow the way those drugs are used as prescribed by their veterinarian. And follow them explicitly. They can't just change something, the dose, the route, whatever, use it in a different animal, use it to treat something different. If the veterinarian has prescribed it to use to treat pneumonia, that's what it's to be used for. And if you have a calf with diarrhea, you cannot, should not utilize that drug then to treat that calf with diarrhea. What you do need to do in that case is talk with your veterinarian, work with your veterinarian, have a really good relationship with your herd veterinarian so that you can work on these problems and use drugs appropriately. And then the other thing that producers need to do when they're using pharmaceuticals in their cattle and processing their animals with different vaccines is that they need to keep really good records on what they've done and when they've done it.
So then there's a big difference then between what we can buy over the counter and what would be something that would need a prescription for, and that prescription would have to be written by then a veterinarian.
Yes. You can. There's some antibiotics that are available over the counter. Some drugs, I say LA200, but penicillin's an over-the-counter antibiotic, which you can go and buy that and use it legally wherever it's sold, as long as you follow the label directions on that drug. Prescription drugs, you can get those from your veterinarian. Your veterinarian will write you, and he can write you a script. Then you can go down to someplace wherever they're sold and buy that pharmaceutical, as long as you have that script, just like you would in human medicine. If you get a script from your doctor to go get heart pills, you go to the pharmacy and get your heart pills. You can do that with your animals too. But you have to follow the way that drug was prescribed, and you have to follow the directions for its use. You can't alter that. You can't deviate from that. If you do that, then we start getting into this extra label use area, and that's a whole different ballgame.
So it would be fair to say then, regardless of whether you're using something over the counter or getting a prescription, that you really need to identify the problem that you've got. You can't. There is no catch-all.
No. And that's as I spoke a little earlier in the day, it's the producer's responsibility to know about the appropriate use of drugs, and then it's their responsibility to identify an animal that maybe something's wrong with it and what do we need to do. They don't need to understand all there is about all the different antibiotics and what's to use and different drugs, how they're to be used in their animals. That's not their responsibility. Their responsibility is to identify the animal. Something's wrong here. Maybe it needs treatment. Maybe it doesn't. Then they go to their veterinarian, work with their veterinarian, and it's the veterinarian's responsibility to then, if a drug needs to be used to treat that animal, and that veterinarian understands that side of the business, what's wrong with the animal, the appropriate use, and the effective use of whatever the drug antimicrobial would be in those cattle or animals.
Good. Well, we appreciate you taking time with us today to talk at the Northwest Florida Beef Conference. And so that basically comes down to the point that you really need to identify what's going on in your herd and work with a good veterinarian to identify the specific problems out there. I'm Clyde Smith from the Jackson County Extension Service here with Dr. Max Irsik, and we wish you a good day.
Thank you.